Hello, everybody. We are back here on Healthcare Experience Matters. Today, we are joined by Dr. Rob Minkes. He is a board certified general and pediatric surgeon who previously served as the system medical director for adult specialty and surgical services at Lee Health in Fort Myers, Florida. He currently serves as physician coach here at the Healthcare Experience Foundation. Today, we're going to discuss the bias aware coaching framework and how it can power inclusive leadership. Welcome back, Dr. Rob Minkes. How are you?
I'm well, Casey. Thanks for having me.
It's good to have you back.
Bias aware is a concept that recognizes and acknowledges that every individual holds inherent bias. And by being aware of them, we can manage and mitigate their effects. And the bias aware coaching framework acknowledges the fact that this is a normal process. We want to normalize our understanding of the process and then be able to incorporate this coaching framework and ideas so that we as leaders or those of us in healthcare can acknowledge the impact that it has and really work to integrate these concepts into the decisions we make to help us move forward in our initiatives towards health equity.
And tell me about the bias aware coaching framework. How does that help people?
So the bias aware coaching approach is structured around a framework that aims to instill and nurture self-awareness, especially understanding the process of bias, as I talked about, and then understanding our own biases and prejudices. It then fosters open-mindedness, and this allows us to understand the concepts that we're talking about, and then understand and appreciate that everybody has a different map or model of the world and brings different perspectives. So with this, we move forward and we gain the knowledge. We become aware of evidence-based best practices that help us in the realm of diversity, equity, inclusion, and then develop the skills to participate, even in the conversations. We know that there are initiatives that are going on at the global level, whether it's the World Health Organization, at the national level, with CMS, and this impacts our organizations, right? We're required now to have health equity as a priority, and this falls on leadership. So how do we grow the skills so we can even participate, understand what we're talking about? And this was a need that came to us from many sources. And so we've developed this program called Bias Aware. With this, with the knowledge, with the skills and understanding, we can then practice and reflect and really commit to lifelong learning in this regard. And that's the basic framework.
I want you to tell me about the 6 core segments of the DEI certification program for individual leaders and teams. And I will talk a little bit more about when that is, and we'll include a link. They can learn more there. But I'll have you just tell us about the 6 core segments of this program.
So I view the segments of the DEI certification program as the building blocks for the bias aware framework. And we begin with an introduction to DEI. We realized that even though it's much talked about, when we try to have conversations and practical conversations, we don't have a basic understanding and way of communicating the concepts in a manner that we can all agree upon. So we rely on industry experts and industry perspectives, and we lay a groundwork of what's being done in this introduction. We believe the answer ultimately is cultural humility, and that's the second building block. And here we learn and maintain our interpersonal stance, understanding power differentials, and become committed to this lifelong process. Next is emotional intelligence, and this segment focuses on our ability to understand and manage our own emotions and recognize and understand those of others and manage our relationships. We have a segment on implicit bias, right, where we delve into really understanding these unconscious prejudices and preferences that develop, and they've become pervasive in our institutions. And so this is another key component. Next is civility and belonging, and this module emphasizes the importance of creating an environment where everyone feels respected and valued and that they belong. And then we close out bringing it all together with inclusive leadership, where leaders learn to foster a culture where this diversity is celebrated, right? It's normalized, differences are embraced, and everyone feels empowered to bring their whole selves to the jobs and the tasks that we have at hand.
Makes a lot of sense. You and I have discussed the importance of overall coaching to physicians in previous episodes. And I'm curious, why is a coaching approach so important to advance DEI?
Yeah. I think we've become very used of having content delivered to us, and it may or may not get integrated into how we think, how we feel, and it may or may not translate into our actions and behaviors. So a coaching approach is pivotal because DEI is not just about imparting this knowledge, it's about transforming our behaviors and mindsets. So coaching can be personalized, it's actionable, and it's centered on the individual. And then as individuals, we can bring that to our teams, bring it to our organizations, and then move the needle. And I think one thing that I want to mention is that there's been incredible work and often inspiring work that's been done in the diversity, equity, and inclusion domain. And again, what we're focusing on is the question that we've heard, what can I do? And so we want to build on this inspiration and empower individuals, right? We want to build on that existing knowledge that's there, share it, make this practical, applicable, right? And make it really approachable for everybody to be able to participate in this journey. And this framework and this program does just that.
That's great. Did you have anything else you wanted to leave us with?
I want to thank you for the time. This has been an exciting journey for those of us who are working together on this project, and we feel the momentum building. We feel and can appreciate the long-term commitment that those who are participating feel passionate about, and really fosters inclusive leadership. So thank you for the time.
Thank you, Dr. Rob Minkes, physician coach here at the Healthcare Experience Foundation, discussing bias-aware coaching framework and also the upcoming DEI certification program. That's a 2-day virtual cohort session, and it's going to have more information about that in the description of today's podcast. That's coming up October 5th and the 6th, 2023. Thank you again for your time today, Dr. Minkes.
Thank you, Casey.